Welcome, everyone, and thank you for joining us for today's topic, Behavior Problems in Senior Cats, Care for the Golden Years. This is the race-approved hour. Our presenter today is Dr. Margaret Gruen, DVM, MVPH, PhD. She is a diplomat of the American College of Veterinary Behaviorists. Dr. Gruen graduated from the University of Illinois College of Veterinary Medicine and then went to NC State for her internship and a residency in veterinary behavior. After some time on the faculty at NCSU, she decided to pursue her PhD in comparative biomedical sciences with a focus on understanding and quantifying the behaviors associated with chronic pain in cats with degenerative joint disease. She is currently an assistant professor in behavioral medicine at NC State University College of Veterinary Medicine. We welcome you, Dr. Gruen.
Thank you very much. Thank you to Assisi for hosting this CE, and thank you to everybody who's here to listen. I am very excited to be here today and to talk about one of my very favorite creatures in the world, which is the senior cat. And while I am excited, I am also a little bit sick. So if you hear me clear my throat, I apologize. I'm fighting off a little summer crud. But let's dive in. Maybe. There we go. All right. So we're going to talk today about general behavior in senior cats. And then we'll really focus in on some of the main players in behavioral changes in senior cats. The two biggest players are cognitive dysfunction and chronic pain, and the effects that chronic pain has on behavior. And I may be a little biased because that's what I study, but I really think that when we talk about cognitive dysfunction and chronic pain, these can be really difficult to differentiate. And both may be present in many cats, but they are large players in the behavior changes that we see in cats. So what are the life stages that we're talking about in cats? Well, cat life stages have been divided up in kitten and junior, prime, mature, senior, and geriatric. And really starting from mature, but especially in our senior and geriatric, these are times for really increased vigilance of the health of our cats. While they are still prime of life times, cats can become less active and social. And many people will attribute some of these behavior changes to just aging itself. So some of these problems can escape notice. We've seen in the literature comments that people perceive cats to be very self-sufficient. And so when they start to withdraw, it can take a little while for people to notice that unless they're looking for it. And so we really want to acknowledge that when we think about the health of our pets and the behavioral health of our pet cats, it's a partnership with the owners. And that's especially true because normal behavior in any species, but really in cats as well, exists across this spectrum. So it's very hard to define what is exactly normal for any cat. And that can make it harder for owners to notice when there's a problem because something doesn't strictly fall into abnormal unless it's abnormal for their cat. And so we really want owners to be thinking about what's normal for their cat during those earlier life stages so they can start to notice what's abnormal for their cat as we reach those more mature and senior and geriatric times. And this is just an example of some of the differences that we see in cat normal behavior. So these are a set of cats, and what we're looking at is really just to illustrate this point. These are activity counts over time for individual cats across 7 weeks. So when we look at our y-axis and we see the changes in the activity means, we can see this huge range for these cats. And what's normal for each cat across those weeks is very different. So it's really important for us to be evaluating behavior changes, including changes in activity, relative to each cat's own baseline. Because you can see we've got some couch potatoes down there at the bottom that aren't changing a whole lot over that time, and then some much more active cats. And so any change has to be relative to that individual cat. So what is somewhat normal? What are the changes that we can expect to see with aging in cats? There are some physical and behavioral changes that happen with age that are pretty common that we can expect. So reduced stress tolerance. which is really important for us to think about when we have these animals coming into our hospitals. They're not as able to adapt. They're not as able to cope. They tolerate stress a lot less, and so we need to be preparing them for coming in. You can see some iris pigmentation changes, decreased skin elasticity, changes in sensory processing, so especially with visual or olfactory. But again, we don't actually know that much about what's normal progression and what's pathologic progression within sort of the middle of the group. The extremes are pretty clear, but within the sort of middle of the group, we don't know what's actually normal, and that makes it harder for us to process what's abnormal. We'll see changes in body composition, particularly in the way that they carry their weight, and changes in their musculature. And the early identification of these is our chance, really, to make changes to improve their quality of life. If we're watching for changes in their ability to move or their ability to get away, we can preserve some of those activities of daily living that are critically important for their quality of life. And we'll talk about that a little bit longer into the talk. So when we think about the behavior problems in senior cats, there are a bunch of them that really do just get chalked up to aging. And then there's some that are more quickly noted. So on the aging side, we can see, again, that social withdrawal. So cats just becoming more aloof and people not noticing for a little while. We can see decreased activity. Again, these are gradual changes. So sometimes they take a while for people to notice. Changes in mood, again, that can go along with that decreased stress tolerance. Or we could see some irritability due to chronic pain. PUPD, a little bit at first, right, when it's pretty subtle. If it's extreme, owners notice it. Slowing, jumping up or down or navigating the stairs. We hear lots of people who tell us, well, I finally trained my cat not to jump on the counter, but they can't jump on the counter anymore, right? We can see mild disorientation, mild appetite decreases, and decreased grooming. And those sometimes get chalked up to aging. Those noticed more quickly are more severe weight loss. Owners will notice that. Nighttime vocalization is a big one, right? Things that change the interaction between the cat and the human. Housesoiling, again, will bring them in. And then more severe disorientation. So those are the ones where people will bring their cat in to talk to us. These ones are the ones that we need to be proactively asking about, particularly as cats move into that mature senior and geriatric time. And again, that's where we really want to be establishing that base point for that cat. And there's some research on what the behavioral presentations are in older cats. Some of this is a little bit older research now, but really was foundational in our understanding. So a study that Dr. Landsberg did that looked at what cats were being presented for at greater than 7 years of age found that the cats coming to veterinary behavior specialists were by and large for Housesoiling, so 73% of them for Housesoiling. And again, I think this is a feature of this research being a few years old now. We don't see as many cats for Housesoiling in the specialty clinic. They really are being taken care of in the general practices. But we will see them sometimes when they're very severe. And then aggression, so 16% of them for aggression. And that may be redirected aggression or irritable aggression, and aggression between cats in the home. On the VIN data side, they looked through what people were asking about for feline patients, 12 to 22 years old. And again, the ones that they noticed were the ones that will bring owners in, right? So excessive vocalization, particularly at nighttime, 61%. Housesoiling, so both toileting and marking. Disorientation, 22%. Aimless wandering and restlessness, which again can be kind of hallmark features of our cognitive dysfunction. Another study looked at the prevalence of behavior problems in senior cats. And they looked at a number of cats by survey and looked at what behavior problems were associated with these cats and were reported in these cats. And they excluded cats who also had a medical problem that could have explained some of the behaviors. So even looking at those cats that remained after they excluded the ones with medical problems, They found that there was at least one behavior problem reported in 28% of the cats 11 to 14 years old, and more than 50% of the cats over 15 years old. So we really need to be asking about these because they're probably there. And the ones that they especially noted, again, were changes in social interactions, changes in their activity, and excessive vocalization. And many of the signs that we see reported in these cats are consistent with feline cognitive dysfunction, but also a whole bunch of other things, right? And that's part of the difficulty with cognitive dysfunction, particularly in cats where it's a bit less research than in dogs, is that it really is a diagnosis of exclusion. So we have to rule out, or at least consider, all of these other comorbidities. I use the term rule out somewhat cautiously because a lot of times we can have comorbidities that are present. We just need to know about them and be addressing them as well. But we can have both cognitive dysfunction and other comorbidities. So before we can make a diagnosis of cognitive dysfunction, we really need to be looking for any of those medical problems that could contribute. So we have to be doing our physical exams, minimum database, radiographs, and then any other additional diagnostics that are indicated for that patient. One sec. Okay. And there's some that we know about the etiology of feline cognitive dysfunction. There's a lot that's still unknown, but there's a lot that's unknown in humans and in dogs as well. So it's still incompletely understood. There are some possible mechanisms that have been discussed, including compromised cerebral blood flow and chronic inflammation, especially exposure to oxidative damage. So as they get older, they're less able to clear and less efficient at the scavenging of free radicals, and that can cause damage to the lipid-rich tissue in the brain. Mitochondrial insufficiency, and that the endogenous antioxidants decline with age. And again, that brain tissue is highly susceptible because it has such high energy demands and has this lipid-rich tissue. And there are several hypotheses, again, that are discussed. There's the amyloid cascade hypothesis. So again, this generation of amyloid beta, which contributes to plaque formation, so aggregation and inflammation. Cats have a more diffuse plaque than we see in dogs or in humans. So again, there are some differences in the species that make it hard for us to know exactly what's going on, but we can understand a bit more about what's going on and what's contributing and what's happening in the brain. Tau hyperphosphorylation and neurofibrillary tangles are also seen in humans. There is some evidence of this in cats. But all of these lead to these cognitive and behavioral abnormalities, specifically by interrupting some of the neurotransmitter functions. And we can see neuronal death and dysfunction there. There are alternative hypotheses as well. And again, there's a lot that's not known. And in cats, we get a little bit less research than we do in some other species, but more research is coming out in cats. But that decreased production of neurotransmitters can contribute to some of the behavioral signs that we see, and also can be a help for us in thinking about what kinds of treatments we can use with these cats. But we can see decreased production of serotonin, GABA, norepinephrine, dopamine, and acetylcholine, which we know are all really big players in behavior and mood and affect. So these can affect our learning and memory and motor function. Sleep-wake cycle, which is a key feature in cognitive dysfunction, and again, that mood and attention, that affective component. So the clinical features for cognitive dysfunction, we really want to think about it as a syndrome. That's how we term it. It is more than one sign. It is a constellation of signs. People will talk about it as feline dementia, but it really is this neurobehavioral syndrome. We see changes in learning and memory, spatial awareness deficits, and there are these parallels to human Alzheimer's disease. And really in dogs, this is studied very closely as a model for Alzheimer's disease. We can see decreased coping ability and adaptability. So again, pulling apart what's that normal and what's abnormal can be difficult for these guys. But we often think about the clinical signs falling under this acronym of DISHA, which has more recently had AL added to it as well. So DISHA is disorientation, changes in social interaction. That's a big one, that the cats can either become more attached to their owners, can be more attention seeking with their owners, or can become more aloof. But again, it's that change from that cat's individual baseline. Changes in their sleep-wake cycles, in particular being up later at night or early waking and sleeping more during the day. Housesoiling, activity changes, so increased or decreased activity. And then that AL is anxiety and changes in learning and memory. Anxiety we can see, learning and memory is a little bit harder for us to measure, right? But we can see that contribute to some of that disorientation. So when we're working with these cats and making our diagnoses, we have to understand that this is a partnership with the owners, because we and owners will have different skills in our ability to recognize particular things about cats. For example, what behaviors cats are performing, we as veterinarians don't often get to see cats at their very best in the clinic. If we're doing home visits, maybe we get to see a little bit more normal behavior, but often we're not able to see the range of behaviors or behavioral changes that their owners are seeing. So the owners are really important and good advocates for their cats, because they can tell us about the behaviors that they're performing. And they can also tell us whether that behavior has changed. So again, we don't get to see that range, and we don't get to see the more gradual changes. The owners do. But where we really need to focus is our skills are in whether that behavior is abnormal. We can help them understand whether that change is important and needs to be considered, or whether it is within our scope of normal. And that's, I think, where there's the gap, because if we're not asking about these behaviors and their changes, then owners continue to think that maybe they're just associated with age and that's normal. And so they don't bring it up. And if they don't bring it up, then we think maybe it's not happening. So we really need to be working with owners and engaging them in understanding what's normal behavior for their pet and what's changed. So really talking with owners about behaviors. Excuse me. So again, this is a diagnosis of exclusion. So we often need serial evaluations. We need a way to systematically measure what's happening with these cats and ask about these behaviors again and again at our visits, starting when they're in that mature age, before we anticipate them having real problems, before we get to that 11 to 14-year age range where we see 28% of them having at least one behavior problem. We want to be doing this during that mature life stage phase. So asking at well visits and annual visits about their cat's behavior on some of these feline cognitive dysfunction screening scales. So we want to gather data, again, so that we can look at what's different for that cat. Some cats have always been somewhat aloof, right? So we want to make sure that we know what's normal for that cat. So when we see a change, they're either more withdrawn or much less and much more attached to their owner. We're able to pick up that change, and that we can help owners understand that that change is meaningful and that we need to look more closely. Our goal with diagnosing cognitive dysfunction as early as possible is to delay progression. We don't have a cure, but we can manage many of the clinical signs, and we can try to delay progression to more serious disease. Okay. Now we'll talk about behavior and chronic pain, and we'll see all of the overlaps. And this is one of my favorite topics because I think it's pretty exciting how much more information we're getting about chronic pain in cats and the behaviors associated with chronic pain and ways to help owners appreciate those changes. So pain is multidimensional. There's a lot of more research and more awareness of the many dimensions that pain can affect. So we've got pain itself, and it's got things we often will focus on. So physiologic, so where is the pain? How long has it been going on? When did it start? something about the sensation. So how intense is the pain? Do we see any sensitization? But more and more, we're understanding about the affective components of pain. I think in cats, this has been clear even for a little longer than in dogs, but we can see these changes in mood and in anxiety. So those affective pieces are really important, and they represent a key piece of understanding chronic pain and its presentation in cats. We can see changes in cognition with pain. And then we also have the behavioral changes, which are key for us, for our species, where they can't self-report. We're looking for those changes in activity and mobility, in those pain behaviors, and then importantly, in sleep. Again, we see that sleep change with cognitive dysfunction as well. And then sociocultural, a little bit less so in our cats, right? That we don't know that they're really thinking about their pain from this standpoint, but it can affect how the owners think about their pain. So it is a piece that we want to consider. We want to understand how owners feel about the pain and chronic pain in general, and then their responsibilities toward their cats. So it's multidimensional and has many contributing causes. So there's, when we address chronic pain, when we approach it, even in our diagnosis, we want to be looking at many of these aspects. So we want to take that multidimensional approach. In particular, for our cats, we're looking at our clinical exams and our pain indicators. So we're looking at our orthopedic exams, what we're seeing in these cats. We're looking at our physical exams when we think about other causes of pain. Degenerative joint disease is what I study, so it's what I think about a lot, but there are other contributing causes to pain, and we'll talk about some of those. But this really key part for us are these owner observations. With cats in particular, we're just not going to get them to trot up and down the hallway. We're not going to see the changes in their jumping as much in our clinics as the owners are seeing at home. So those home behavior changes become really key. So our development of scales for owners to complete and our ability to appreciate videos of the cats in their home environment is really important for us to be able to make these diagnoses. So again, these contributing causes: degenerative joint disease, which I think about a lot, but there's surgery and long-term effects of surgery. Dental and oral pain is really important, and especially in cats. IBD, interstitial cystitis, and chronic dermatologic disease can also be very painful. And neuropathic and neurologic pain as well. Okay. So the characteristics of chronic pain that are important for us to think about, one is that it's really not defined by time. So for a long time, we were trained that after about 3 months, acute pain has transitioned into chronic pain. But actually, there's a lot that goes on pretty early on in this process. Later on in this process, there is no specific time at which we can say, okay, now it's chronic pain. But we can appreciate some of the features that are characteristic of chronic pain. And one of these is central and peripheral sensitization. So in this chart on the right, what we see is the pain intensity versus the stimulus intensity. So in blue, we have our normal pain response. So as the stimulus becomes more intense, the pain intensity goes up. And that's what we would see in a normal animal. When we have injury or chronic pain with central and peripheral sensitization, we see a shift in that curve to the left so that we see stimuli that should not be considered painful, that shaded area of red, are perceived as painful, and that's our allodynia. And then stimuli that are, by normal animals and normal people, considered painful are more painful at a lower level. So that's our hyperalgesia. And this can lead to behavioral changes, right? Because we have this hypersensitized system, we can have defensive behavior, right? Don't touch me, that hurts, I don't want to do that. And learned avoidance of behavior, of behaviors or activities that are associated with pain. So we think about that with litter box use, for example, or some of that social withdrawal. They don't try to get up on the couch anymore because it's been associated with pain. So the big players, again, degenerative joint disease is a very big one of the most common ones. So we know that about 90% of cats will have radiographic signs that are consistent with degenerative joint disease. About 50% of them will have clinical signs of pain associated with that. So that's a lot of cats. But there are these other things that really can contribute, dental disease being a big one. So 68% of cats over 3 years of age are affected by dental disease. And this is certainly a source of pain for cats. Gingivitis, periodontal disease, stomatitis, tooth resorption. These can be particularly painful even at early stages, and again, can contribute to that more generalized sensitization with the behavioral changes that come along with that. Obesity, not thought of as painful itself, except that it is actually an inflammatory disease state, and we're appreciating that more and more. It also exacerbates orthopedic disease, particularly early on in the development. There's more mechanical load on the joints themselves, excuse me, but there are also these inflammatory cytokines, the adipokines, that are circulating. In addition, obesity can contribute to more anxiety-like behaviors because it can impede their ability to reach places that are preferred resting areas, or to escape from, say, that new puppy or the dog that's a little too excited to play with them. When they can't get away, that inability to escape can exacerbate anxiety and lead to more of these defensive behaviors. And it also can prevent maintenance behaviors like grooming. So it can become more difficult for these cats to groom, particularly in their hind ends. And 1 second. Thanks for bearing with me. Okay, gastrointestinal disease can be another cause of pain, visceral pain. We can see abnormal oral behaviors like pica, and there's more and more appreciation of the gut-brain axis and how that can contribute to behavioral changes. So in our chronic pain, our big group of cats with chronic pain, and our cognitive dysfunction, we can see a lot of overlap in these signs that make it really difficult to determine which one is contributing most, right? So if we look at our circle for cognitive dysfunction over here on the left, one of the things that really differentiates it would be disorientation. We don't see that as much with chronic pain. If we look over at our chronic pain side, we can see aggression, altered gait, and some hunched body position. Those are more likely to be chronic pain. But in the middle, we have this huge group of overlapping signs where both may be going on, but it is difficult for us to really pull apart which one is contributing the most. So we've got our Housesoiling, vocalization, changes in social interactions, and anxiety. So again, these are things that can be going on together. And pain can contribute to cognitive impairment, which is another really important piece, right? So if pain is disrupting sleep and the ability to get good sleep, we all know how poorly we function on low levels of sleep. When our sleep is impaired, it's difficult to think as quickly. So we can see cognitive changes that are, again, working in concert with that discomfort and pain. So how do we address these? What is our behavioral treatment plan for these cats? We really have a similar framework to the plans we make for younger animals, right? We don't treat them any differently as far as our overall approach. There are just some special considerations that we want to make for these older guys. And with all behavior problems, we want to take a multimodal approach. There's no one size fits all approach to any behavior case. And there's usually no one thing makes the big difference for any of our behavioral cases. We want to really approach them from multiple angles, which we'll talk about. Obviously, if there's physical health concerns, we have to address those. It's very difficult to change behavior when there's a physical or medical concern present. And so again, while we might not be able to cure whatever that is, we need to at least understand its contribution and be managing it to the best extent that we can. That includes management of pain. So being able to address pain in cats. We want to look at their mental and emotional health. How are we setting up their home? Are we able to meet their needs for social interaction and engagement, and also for time alone, right? Environmental management so that we can avoid triggers for problematic behaviors, which we'll talk about. And then often we use medication for specific stressors or if needed for more generalized anxiety. So this is how we kind of think about our behavioral treatment plans and our approaches to behavior are these three big areas. So our behavior modification, our environmental management, and modification if needed, making sure that we're meeting that cat's needs, and then behavioral medications where they're indicated. So in senior cats, there are a few considerations that we want to think about. So again, a lot of these changes will be progressive. Chronic pain we can manage, but can be progressive. Cognitive dysfunction, again, so we want a slow progression wherever possible. And a lot of that is through environmental enrichment and modification. People often want to talk about the medications that we use, but this environmental piece is so critically important for these cats, making sure that we can preserve their activities of daily living, keep them comfortable is I cannot understate how or overstate how important that is, and we'll talk a bit more about that. Dietary modification can be used, especially for managing pain. So there are several therapeutic diets on the market. The omega-3 fatty acids have actually been shown to be useful, particularly for managing chronic pain. And then some pharmaceuticals. So pain management, again, cognitive function support, or addressing specific clinical signs, particularly anxiety and sleep-wake cycles. So our 3 tiers of treatment in our environmental management piece are those social interactions, meeting the needs of the cat, and knowing what the needs of the cat are, right? There are cats who crave social interaction and some who want some social interaction, but then also want some time alone. And so we need to meet that cat kind of where they are, making sure we provide opportunities for mental stimulation, and then physical exercise. Keeping them moving can keep them healthy. There's lots of evidence in many species that physical exercise is important for the management of pain, particularly with arthritis. Okay, so those environmental modifications, what do we need to do for those activities of daily living? Pardon me. Okay. We want to keep them comfortable. We want to keep them resting. We want them to have comfortable places that they can rest and that they can access. Heated beds are one of my most favorite things for cats, older cats in particular. I like them a lot also when people are having trouble keeping their cat out of a certain space. If we give them something really attractive nearby, like a heated bed, they'll often choose to use that place. So instead of continuing to move them from where you don't want them, show them where you do want them, set them up to succeed by giving them something really attractive. And these heated beds can be great for some of these older cats and those with pain. Make sure that they can still access places that are important to them. We'll talk about some of those activities that are important for quality of life. Being able to access escape areas or preferred resting spots can be really important for their quality of life, right? Their ability to get up and look out the window, or get up onto the bed, or get up onto the chair. So providing surfaces that they can walk on, so non-slick surfaces that have stairs or a ramp that allow access for them to those areas is important. And we want, again, to be engaging with owners and talking about when these drop off so that we can help them figure out what kind of management they need in their home. Again, those comfortable resting areas. We want to provide multiple opportunities for them to get water in many areas. If they're not moving around quite as much, we want to make sure that we're providing water in a form that they like and in multiple locations. So some cats really do like moving water. I really like this water bowl for cats that do, but there was a study that was done by a colleague of mine that showed that some cats love moving water and some cats just don't, not even at all. They prefer to drink out of a still bowl, and some will be half and half in what they choose. So really knowing what that cat likes is important. Providing grooming opportunities, that's another good opportunity for owners to socially engage with their cats as well. So finding the comb or brush that the cat really likes, whether that's a gloved hand or a brush. Some cats require some trial and error. My cat, and it's wandering around here somewhere, only likes one particular brush. The rest of them, not even a little. But keeping them clean, providing litter boxes that they can access, that they can get into and out of comfortably, particularly as they have more chronic pain. Being able to access that litter box is key. And maintaining hygiene in their hind areas is also really important. But these litter boxes, we do know some things about what cats like as far as litter boxes. There have been some really neat studies that have looked at litter types and litter boxes and size. We know that cats like really big litter boxes. 1.5 times the length of the cat is what we'll often talk about. But they need to be able to get into and out of them easily. And so there's a lot of great do-it-yourself versions of these, because many of the commercial litter boxes are just not that big. Even the best of them are not that big. So we often use these Rubbermaid kinds of tubs and have people cut them down, and so that they can allow access. We do see some cats where we see changes in the way that they posture to eliminate, with especially hip pain. So they may be able to crouch to eliminate, but they can't hold that position as long. So they stand up. So then it ends up looking like they're eliminating outside of the box, when really they just can't hold the position. They're doing the best they can. And so sometimes these very deep boxes can be great for that, but they wouldn't be able to jump all the way into it and jump comfortably out. So we have to give them an access port. Okay, and as I mentioned, these activities that are important for cats' quality of life are not all about activity. So as someone who studied activity and mobility, I thought a lot of them would be, but we did this study where we looked at the activities that owners said were important for their cat's quality of life, and we categorized them. So there were 500 activities, 5 per cat, and categorized them into activities that were active, so running, playing, that sort of thing, inactive, sleeping, and then a set of them that implied activity. So what I mean by that is they would be something like resting, but it was resting in the windowsill or resting on my bed next to me. So things that meant that the cat still had to be able to move in order to do that quality of life activity, but it itself was not active. So I think that's important, because I think it really highlights for us that when we talk with owners about what's important to their cat, it's not only their ability to move, it's their ability to get to those preferred and comfort places. To spend time with their owners may mean that they need to jump up onto the couch, and we may need to provide a way for them to do that. So a lot of these activities that owners felt were important didn't actually involve activity at all. And again, we say this with the caveat that these are what the owners think is important for their cat's quality of life. I do think owners are very good advocates for their cat. We weren't able to ask the cat directly, but these are the things that owners really think of as critically important for their cat's quality of life. Okay, mental stimulation. There are a lot of toys that are out there that can be mentally stimulating. Food puzzles are fantastic, and there are a lot of them that are developed for dogs. Nina Ottenson has a great line of toys that are food puzzles that were targeted for dogs, but actually cats can do them really well. There's a great YouTube channel of a cat who tries out all of these different toys and is just a master of doing them. But these can provide a lot of mental stimulation, and they're great in terms of being able to be manipulated by the cats. I think sometimes the cats are even better than the dogs at them because they're so agile with their paws. All right, so medications and supplements do have a place. Again, we are really trying to do symptomatic relief. There's no standout treatment that will address all of the problems that we see. We're often targeting specific symptoms. Selegiline for cognitive dysfunction. This is approved for the use in dogs and often is used in cats at a lower dose than in dogs. There are antioxidant diets and supplements, so for free radical scavenging. Senilife is one of those. There are supplements for omega-3 fatty acids, DHA and EPA, SAM-E, L-theanine, which is an extract from green tea, is used for addressing anxiety. Alpha-casozepine, which is the milk protein extract, and then combinations of these can be used. It's important to say that combinations of serotonergic medications cannot be used with selegiline, and I'll talk about that in just a second. But many of these are generally mild anxiolytics, and some of the supplements can be really good choices due to their low side effect profiles. We do want to be careful with certain medications that we can use. So TCAs like clomipramine or amitriptyline can inhibit neuronal firing and cognitive function. So they're probably not our best choices for cats. And then again, as I said, there's a high risk of serotonin syndrome if we use serotonergic drugs with a drug like selegiline, an MAOI. So SSRIs, any of them, fluoxetine, paroxetine, trazodone, opioids, certain opioids, and then mirtazapine, which we're using more and more in cats. We need to think about that one if we're using anapro. And then benzodiazepines, which we often avoid the use of oral benzodiazepines in cats anyway, but we do sometimes use them for addressing specific anxieties, and they are implicated in some cognitive decline in humans, although there is some conflicting research on that, but it is something to think about when using these in cats. Anesthesia. I did a talk with an anesthesiologist friend of mine on anesthesia in cats with and dogs with behavioral medications and just older pets in general. And there's some evidence for increased cognitive decline post anesthesia in older human patients. There is some work that's starting to be done on this in dogs, and some that's come out, but anesthesia, we need to balance the risks, right? Because cats can feel much better after a dental procedure. And so we do need to balance the risks there, but it is something to consider and have owners be watching for, at least initially. So again, general anesthesia, benzodiazepines, and the anticholinergics. These are more pronounced in patients who show signs of dementia prior to surgery. So any human patients in particular that have some signs of dementia prior to surgery can be greatly exacerbated post-anesthesia, a little bit less so if they did not have evidence of cognitive decline before. All right, so our treatments, again, are often targeted towards specific clinical signs. One of the big ones that we talk to people about a lot is that yowling cat, right? Nothing will bring a cat in faster than yowling at night. And this is a behavior problem that can really impact the human-animal bond pretty quickly as they're keeping their owners up, wandering around, yowling. So we want to address certain specific behavior problems, and this is one of them. So when we can, we want to look at and manage the underlying cause. Again, these are ones that we want to address as a priority because of that damage to the human-animal bond. We can change cat sleeping environments. We can try to entrain a more appropriate circadian rhythm. So remember, cats are crepuscular, so they're a little bit more, they are more active at dawn and dusk. So we can expect some of that to be just normal cat behavior. But if they're sleeping much more during the day, particularly during the times we know cats should be active, so in that morning time when people are getting up and moving, we have a lot of evidence that cats who live inside homes will adapt to that slightly more diurnal pattern, where as their owners are up and moving around in the morning, they're up and moving. And then in the afternoon and evening, as owners come home, they're more active. If they're sleeping during those times, then we can see that shift in their awake time. And so we want to be engaging with them during the times that we're home and active. We want to try to get them awake and moving and interacting with us so that we can encourage better sleep during the nighttime. We can block noise. So for the cats, we want to provide noise buffers so that there aren't things that are potentially waking them up. We also, if we can use white noise machines and block some of the cat noise for the owner, that can help with that important sleep for the owner, decrease in their irritable aggression due to lack of sleep. We can use anxiolytics and cognitive dysfunction supplements, and then adjunctive like music or aromatherapy. Again, we're really trying to encourage these cats to sleep during the nighttime period. In Housesoiling, again, this is a problem that we see in both chronic pain and cognitive dysfunction, one of the most common presentations for cats with behavior problems. We want to make sure that we're not having a problem with access, that it's not that the cat can no longer find or get to their place. So a cat who, you know, for years was happy to go down to the basement to use the litter box that's down there, maybe is less tolerant of doing that now that they're a little bit more painful. They don't see as well in the dark. We know that cats are more likely to use litter boxes and to cover and dig in litter boxes that are within their core area. So where they spend about 50 to 70% of their time, those are the areas that we want to have a litter box in. And especially as we get into these more senior and geriatric years, we want to make sure that we're providing enough access for them. Consider their placement and their height, again, as we discussed. So having them in places that are inaccessible for cats and too high for them to maneuver in, like this place that's maybe really convenient for younger cats, much less so for our older cats. We really want to think about where they are and making sure that we have enough of them. Cats who like to urinate in one and defecate in the other, or definitely are not going to use a dirty litter box, but now are having to go a little bit more often. We want to make sure that we're providing for them. So we want litter boxes that are separated from each other. These two are not quite separate enough, but are a great example of litter boxes that provide access for cats who may have more difficulty maneuvering. We can think about retraining. Really, when we think about that for these guys, it's associative learning after aversion. So if we have painful experiences in the litter box, we have cats who are no longer going into the litter box because of that aversion, we can set up more attractive, we can go through really our Housesoiling protocols, looking at our litter box buffets, finding out what they like, and making sure that we are avoiding any of the associations with pain in the past. And we really want to engage our owners to promote behavioral health. I love owners to keep track of the daily activities that they think are important for their cat, because those will be different for many different cats. But if they can maintain and update that list of activities, that can help them notice subtle changes, because a lot of these changes are really subtle until they're not. Right? So they change gradually over time. And at some point, people will notice that their cat's no longer doing something, but they could have seen it much before if they had been looking for it and asking about it. We want them to be informed about the significance of changes in behavior. And this is really on us as veterinarians to help them understand that the presentation of chronic pain or even cognitive dysfunction is not exactly the same in cats as it is in dogs, and so, or in humans. So we don't want them looking for that limp, right? We want them looking for a slowing down, a change in how they go up and down the stairs, that they're suddenly trained not to go onto the counter. We want them to know that those behavior changes are important, and that we want to hear about them. And then we want to make sure that they're making changes necessary to protect their cat's ability to perform those daily activities. Those activities of daily living are important for everybody's quality of life, and that is true for our cats as well. We can keep a list of those activities in the cat's record so that we can monitor them. We can ask about them. So we can look at our general screening tools, but we can also ask about activities that are specifically important to that cat and just check in on them as we go. Screen for cognitive dysfunction and for pain. Again, those serial evaluations may be necessary because of the wide range in baseline behaviors in cats. Consider the household. So there's lots of things that when people bring us videos or pictures can give us more insight. So they may tell us that their cat's not walking across the room anymore. And then when we see a video or see a picture, it's a slick floor like an ice rink. And if we just put in some rugs, sometimes we can improve that cat's ability to just walk around their house. So asking people to show us, to share with us what their cats are doing in their homes can make a world of difference. Train our technicians to be observant and to make recommendations. And then we can really listen to the owners. When they tell us that something's changed, we want to be paying attention. And that charting and progression as cats age can be really important again in that assessment of these more chronic changes. And it can allow us to really help make decisions as we move along. What's okay? Where are we with managing this pet's pain? Excuse me. There are health-related quality of life scales. Some have been developed specifically for certain problems, cardiac disease and chronic kidney disease, but there also are some more general ones. Jackie Reed has, with Vetmetrica, a great quality of life scale, and there are apps that people can use now. There's all sorts of ways that people can be monitoring their cat's quality of life. Making sure we help owners understand what's important for cats' needs, what those pillars are of a healthy feline environment, what their specific cat's needs are, and then what changes need to be made for our senior cats to make sure that we're continuing to provide this. The environment we provide for a young adult cat may not be sufficient for a senior cat. So we need to continue to evaluate what we're providing. So in summary, our golden year cat, our behavior problems and behaviors in senior cats are, we do really approach them the same way. So we look at that triad of behavior modification, environmental management, which is hugely important, and medications or supplements as needed. Cognitive dysfunction and chronic pain can underlie a lot of the behavioral problems seen in older cats. So these really need to be addressed. And our goal is to keep senior cats healthy and comfortable into their golden years.